Good morning, and welcome to our continuing series on homeopathy with our Dr. Pachegaonkar. Namaste. The subject of vaccination, immunization, has been written about by Sri Aurobindo, who did not recommend it. Can you further enlighten us?
See, immunization is with the purpose of preventing illness. In general, if you prevent illness, is fine. But there are some illnesses, say like chicken pox or measles or even mumps. These illnesses, they render lot of beneficial effects if they come in childhood. Like we have seen the child having measles, chicken pox, mumps in childhood. The children develop wonderful immunity which lasts for whole life.
But we have seen sometimes that pustules come on the face, and the face is damaged.
It is only for a transient period of time. Say especially chicken pox. Chicken pox, we have seen that children develop pustules and those eruptions, vesicles they develop, they heal and the scar completely is absorbed.
I see.
It was with smallpox earlier,
Ah,
which used to give lot of scarring, not measles and chickenpox.
okay.
Whereas there are few illnesses where they are fatal, say like hydrophobia, and there it is fatal. So we recommend having immunization for that. That too, if there is a vulnerable dog bite or something, not otherwise. So it doesn't come under mass immunization.
Ah,
But whereas there's measles, chickenpox, polio, and these are given as mass immunization,
yes,
even
yes.
influenza, and these are totally undue.
Well, influenza is
Yes,
rampant all over the world now,
yes,
especially
but
in the US.
yes, but at the same time, influenza is all over the world.
No, I mean
Huh.
the vaccinations
Vaccinations are
are
common. You see,
common.
vaccination every time the strain of influenza is different. So every like 30 years, 40 years, 50 years, it is not the same influenza. It is a different strain of virus. And definitely the vaccination also is not that much useful. At the same time, you are creating harm by vaccinating the person. There are so many instances because what is vaccination? After all, it is a attenuated virus. Same thing we give as vaccination in a what we call sublethal dose, where the person develops a syndrome and then develops immunity. So it is a type of active immunization. So there, what happens that children do develop immunity with that, but there are even adverse effects. Even in natural occurrence of infection, children do develop immunity against flu. In viral fevers and all, we have seen that the person comes down with little bit of indisposition or simple illnesses like fever and toxicity and body ache, and if the person undergoes good rehydration and rest, the person develops immunity against that. Rather, it's an exercise for developing immunity. See, I remember almost like 30 years earlier in India, they used to vaccinate on mass scale the people coming for gathering for pilgrimage in one place. Like if you know, near Pune, there is a place called Pandharpur. and once in a year they have that Ashadi Ekadashi, they call it. At least 500,000 people gather for a day, and it's a small township. So there they used to give compulsory vaccination for the people who enter that place
Against what? Against
against cholera.
influenza?
Against
Oh,
cholera.
cholera. Okay.
And later they realized that the cholera vaccination gives only 30% immunity, means there is a chance that 70% may get it. And those days I remember that giving, see, like almost 4 lakh, 5 lakh people giving injections, intramuscular injections. And the health machinery used to sit there with a tub of boiling water, and that syringe and needle, same needle, they used to just have a boiled water taken in and all, that's all, aspirate boiled water and leave it and reuse it. Same needle they were using. Imagine how much vulnerable the whole population was
Yes.
for under this cholera infection. And we have seen that cholera infection is mainly when the person is susceptible. Otherwise, it doesn't cause any harm in the person. The Vibrio cholera infection, if the condition is conducive in the person, then only it thrives. Otherwise, it just goes subclinical manifestation. And now that vaccination is not at all common in India. But already almost like 20 years they have pumped this cholera vaccination on mass scale and in this fashion. So how many people must have been, cross infected because of this process?
And the needles.
Yes, but now thanks to these AIDS which came up like HIV, and then the fraternity started using disposable needles. Otherwise, they were
Yes.
using same needle,
Yes,
boiling
yes,
and using it,
yes.
so-called sterilization. So really, vaccination, like even polio. See, polio infection also goes in a subclinical way. The child develops little bit of fever and diarrhea and develops immunity against it. It is only when there is a prick during this infection the child develops post polio paralysis.
Yes, you
Otherwise,
mentioned.
nowhere polio disease is fatal.
It could be any kind of prick, just
Any.
opening the skin.
It can be a prick, it can be a thorn prick, it can be needle prick, it can be anything.
Oh.
So there, whenever there used to be one case detected around, the whole district health authorities used to issue instructions that no injections in children, no injectables in children, unless they are vaccinated or immunized. Because we have seen, like there was a wonderful instance in our district. 43 cases of post-polio paralysis were detected in the district, in Beed district alone. The whole health machinery was alerted and they started surveying. And the best part of it was that all these 43 cases were from urban or semi-urban area. Not even a single case was from villages. And when we started like pondering upon it, that why there is not even a single case of post polio paralysis in villages, and then we realized that in towns or townships, people are what we call extra vigilant, ultra vigilant about fever. So the moment child develops fever, within few hours they used to approach the doctor, and doctors very promptly, it was fashion in India those days, that they won't consider the tablets and syrups to be the medicine. Has to be injectable medicine, and they used to give some injections of antibiotics or vitamins, and the child used to come down with post polio paralysis. So all 43 cases in that month were from townships, whereas in villages it is a custom that 1 or 2 days if fever is there, they don't approach doctor, they manage in house by giving ample of fluids, rest and all that. At the most some home remedies they will give. They will never approach doctor unless the fever lingers for more than 2 days or 3 days. and therefore not even single case in the district from rural area came down with post polio paralysis. So this itself suggests that immunization against polio is not necessary. It is all what we call, we invite those post polio paralysis conditions where we give prick to the child. Only thing is, once the child develops fever, whatever type, fever or any illness, you have to see that the child is under rest, not vulnerable for any pricks and all. Otherwise, this polio disease is resolved even in a subclinical phase. You don't need to intervene at all.
So, in general, you recommend against vaccinations except in certain cases.
Yes, but that is again not a mass vaccination.
Not mass, yes,
This
never mass.
hydrophobia and all. It should be like where there is a vulnerable dog bite.
Yes, of course.
So,
right.
so we recommend that if it is a like pet dog, you immunize that dog against hydrophobia. And if dog is not vaccinated, and then there is a dog bite, that too unprovoked dog bite, then we recommend hydrophobia, that vaccination. Otherwise, not at all necessary.
Thank you, sir.